Hi everyone, and welcome to a very short video about medication administration. Really the things that I want to hammer home about medication administration is that you have to understand that this is one of your primary responsibilities as a registered nurse. I cannot emphasize enough to you how important it is to follow the rules of medication administration. And those rules pertain to those 6 rights, right? That we have the right patient, that we have the right medication, we have the right dose, we have the right route, we have the right frequency, and of course the right documentation. That involves, of course, also identifying our patients by name and date of birth, asking them to tell you their name and date of birth, verifying it with their ID bracelet that they are wearing, and if they're unable to answer you, you can verify by using their bracelet and perhaps another staff member who knows who that patient is, right? That makes sense, I hope. And so when we're talking about medication administration, there's so many things to think about, right? It's not just a matter of opening up a pill package or opening up a vial of medication or hanging up an IV or giving an injection. There's a lot of technical steps involved in those processes, but what it's about is knowing why your patient is getting a certain medication, if it's indicated for them or one of their disease processes, and thinking about what are the potential adverse effects of this medication. Not just the adverse effects, right, the things that could go wrong giving a medicine, but what about the therapeutic effects? What do you expect to see from giving that medicine, right? Think about if you give an antihypertensive drug, do you expect it to lower the blood pressure? Yes, right? Think about your assessment that you need to do before and after you give a medication. If you're giving a bronchodilator to clear up wheezing in a patient, you're auscultating their lungs before you give the medication, and then you're auscultating the lungs after you give the medication. If you're giving that antihypertensive, you're checking blood pressure before and after. If you're giving some kind of a supplement like potassium, well, what is the patient's potassium level? Think about the pharmacodynamics and the pharmacokinetics of the medications that you're giving. You're learning a lot in pharm about medications in general. But here in fundamentals, we're talking about what are the steps to actually give the medicine, right? And what kinds of medicines are we talking about? In this video, I'm going to focus on PO meds and meds via alternate routes. Alternate routes are things that include things like patches and topicals, creams and ointments, eye drops, ear drops, suppositories, both vaginal and rectal, other vaginal medications, inhalants, right? Things that are by meter dose inhaler or nebulizer treatments, right? So that's just a few of the more common ones that you're going to see in the clinical area once you start administering meds. I also want to take a moment just to remind you that in the clinical area, you are not ever permitted to give medications without your clinical instructor right by your side. So that means that you can't give medicine with the nurse, you can't give medicine with the doctor, you can't give medicine with anybody other than your clinical instructor. Hopefully you'll get some experience during your clinical rotations. So I want to show you just a couple of the pieces of equipment that you're going to need for medication administration. So when we're talking about PO meds, you're going to need some form of a cup, right? And these paper cups are usually used for pills and tablets, right? And then we have another type of cup. It's a plastic cup. I'm not quite sure if you can see the calibrations on this cup, but you can see that things are in drams, things are in cc's or milliliters, and then we also have things in household measurements like teaspoons and tablespoons. It's very important that you know your conversions, right? So if we think of an example like a teaspoon, so a teaspoon of medication is actually equal to 5 milliliters. You also need to know that there are 3 teaspoons in 1 tablespoon. So if you were going to do that in milliliters, you would be talking about 15 milliliters, right? 3 teaspoons at 5 each equals 15 milliliters equals 1 tablespoon, right? You also need to know that 1 ounce is equal to 30 milliliters. And this cup actually is 1 ounce. It will hold 30 milliliters of medicine. Now, what's really important about pouring a liquid medicine into these cups is that you can't hold the cup up like this, right? We don't do sort of this eyeballing thing. What you need to do is you need to bring that cup down to a table, and then you need to bring yourself eye level down when you are pouring that, so that we want to make sure that you're right exactly on the line of where you need to be to administer that. So some of the pills, they come in different types of packaging. So here's a type of package, and here is another type of package. And then we have a medication that's actually a powder that needs to then be mixed with some water to turn it into a liquid medicine so that the patient could drink it. So let's talk a little bit about the packaging. What's important is when you're reading the package, of course, it's going to give you the name of the medication. Usually all medicines are by their generic names, right? It's important to know some trade names, but the generic name is what you really need to know, because in almost every healthcare setting, you're going to be giving medicines by the generic name. So the other thing to make notice is the quantity of medicine that's actually in the package and how much each, let's say, tablet is worth in terms of amount of medicine. So if we read this package here, this is aspirin, and it says that it is 325 milligrams. Now, what's really important to note about this when I open up this package is that we're going to find that there are actually 2 tablets in this package. So what does that mean? Does that mean that these 2 tablets make up 325 milligrams? The answer is a big no. What it means is that each one of these tablets is 325 milligrams. So if you had an order that said to administer 325 milligrams of aspirin, you would be giving one of these tablets to your patient, and the other tablet, generally, these tablets are discarded, and in every healthcare setting, you're going to find that they have a place for you to discard unused medication, right? Because we don't want to put it down the toilet or down the sink, because it really is not good for the environment, okay? Now, when we're opening up a package, such as that aspirin package, what we want to do is open it up, and we want to keep our fingers off of the medicine. Okay, so we want to kind of, pour it into the cup without touching it. We never pick pills up and put them in the patient's mouth, right? We use the cup for that purpose of giving them the pill. If the patient wants to take it with their own fingers, that's totally fine, but we're not putting our fingers on the medication itself. Now, the other type of packaging is sort of this individual dose packaging. And what I'm going to show you here, I'm just going to take this label off here for a moment. What I'm going to show you here is with this medication, it gives you, again, the name, and it gives you the amount of the medicine that's in there. Now, the way that these come out of these packages, there's a little bit of foil. I'm not sure if you can see sort of that circle of foil around the pill, right? So what we want to do is we want to push the pill like this into a cup, okay? So if I do that back over here, I know it's a little far away, but you can get the idea. I'm going to sort of pop that pill and get that pill into the cup, okay? So we have that pill there. So that's how you open those types of packages, just sort of a push through to get those medicines out of there. Now, if we're talking about a powder, so these are interesting because the powder, so this particular packet says that this medication is Tegretol. It's a medicine that's given for seizure activity. And it says that the dosage is 100 milligrams per 5 milliliters. Okay? 100 milligrams per 5 milliliters. So on the back, it gives you a little idea. I'm just going to take my glasses off so I can see better. On the back, it tells you things such as, I'll hold one up here so that you can read it. It says initial dosage, less than 6 years old, 10 to 20 milligrams per kilogram per day, QID, which you remember is 4 times a day. 6 to 12 years old, a half a teaspoon QID, or 200 milligrams per day. And then more than 12 years old, 1 teaspoon QID, or 400 milligrams per day. So you can see if the child is smaller, right, under the age of 6, we're going to be weight basing this medication, right, because it's, again, per kilogram per day, okay? Now, also on the front of the package, let me flip that around. On the front of the package, it says that the dosage is 100 milligrams per 5 milliliters, but it tells you to dilute the contents with 20 milliliters of water. So here's an important thing, right? First of all, I'm going to flick this a little bit because I want that powder all down at the bottom of the package. I'm going to peel this open, and I'm going to put this powder in one of my plastic cups because I'm going to be putting liquid in there. So I'll put this powder in here. Okay, I've got the powder in the cup. I'm going to take another plastic cup and I'm going to fill it to the 20 milliliter line, which is right here. And I'm going to put that, let's do that. I'm going to do that. I'll mix it up for you. Okay, so let me pour out this 20 milliliters. I have it on the desk here, so I'm going to get to exactly 20, okay, and I am going to pour this liquid into here. Now, if I had a spoon or something that I could mix this up with, but I don't have a spoon, so I'm just going to kind of do this. I'm going to pour this back and forth, okay, until the powder is completely dissolved and it is becoming a, liquid with the medication, okay? I still have some powder left in there. I'm going to continue to go back and forth until I have it completely dissolved. We're getting there. Okay, so now I have my medication dissolved. I have this nice yellow liquid here, but I want you to remember what that packet said. It said to add the 20 milliliters, which you did, right? Or we did, or I did. And then it tells us that it's 100 milligrams per 5 milliliters. So if I had to give 200 milligrams, how many milliliters would I have to give? I'm hoping that your answer is 10. Right? Because if there is 105, even though I have this 20 milliliters, this 20 milliliters does not equal 100 milligrams, right? Like the package says. The package says that 100 milligrams is in 5 milliliters. So if I've got to give 200 milligrams, then I'm going to be giving 10 milliliters of this solution. So I could pour it into a second cup. Right, let me get my marking here for 10, and there we go, 10 milliliters. So this is what my patient is getting, half of what was originally in this cup, right? So you have to be very careful with this type of packaging, right? Make sure that you read your packaging. Make sure that you understand what the dosage is in comparison to what your dose is supposed to be, right? There's a difference between dosage and dose, as we discussed in the lecture. Okay, I want to show you another type of package. So this is a package where, again, it's very similar to what we saw with this sort of gold package here. And again, there's one pill, this is a unit dose, and again, we're going to be doing that popping out right through the foil in the back. I also want to show you, so we looked at some tablets, and let's say that we needed to give a half of a tablet. A half of a tablet. So an important thing to note about tablets is that in order for you to give a half a tablet, it has to be a scored tablet. Okay, so I think my little orange one here is actually a scored tablet. Yes, it is. So we need some way to break this tablet in half. So we have these things called pill cutters, okay, and it kind of looks like this. I want to show you this side of it here. So this thing right here, I'll turn it on its side a little bit. You can see this is a razor blade. Don't stick your finger in there, okay? So what you do is your pill goes right here up at the top of the triangle. Okay, we'll get that pill right there. And you close your pill cutter, and that razor blade cuts your pill in half. Okay, so we have now 2 equal halves of pill. Why is it important to have to only break pills that are scored? Because the manufacturer makes the pill so that when it's cut in half, or if it's scored in quarters, when it's quartered, that each one of those pieces will have an equal amount of drug in them. If you split a pill that is not scored, you're not guaranteed to have equal half and half medicine, okay? So that's why we only can split pills that are actually scored, okay? And again, you would discard that other half. Okay, last thing I want to look at in relation to pills is that of capsules. So this is a capsule. This is something called temazepam or Restoril. This is actually a sleeping aid. And if we were to open up this, and I'll just take it out with my fingers just to show you. Of course, you know that capsules are things that can be separated from each other. Now, sometimes you may have patients who are unable to swallow capsules because they're bigger, usually than pills. So what you might need to do is open up this capsule, and you can do it by just twisting it from side to side and opening it up and getting the contents out of this from the inside. Sometimes you'll find that, like in this particular case, this is a powder that is in here. It's kind of hard to see because it's white on white, but there's a powder in there. So you might need to put that on perhaps some some applesauce or something like that. Now, just as a little aside, as a tip, when you're mixing pills or powders with things like applesauce or pudding to get your patient to swallow them easier, please don't mix it in like a cup of applesauce or pudding, right? Because if your patient doesn't eat all of the applesauce or the pudding, then how do you know how much medication they got? You don't really know, right? Did they get a quarter of it? Did they get an eighth? Did they get 3/4? You have no idea. So mix it with the smallest amount that you can, right? Usually what I do is I would fill this thing up about halfway with the applesauce. I would mix it up, make it into 1 spoonful, give it to the patient, and then I would have some regular applesauce or pudding without medicine in it, right, that tastes better, and then I would give them a couple of spoons of that to kind of get the bad taste out of their mouth. Now, one of the things that's really important about crushing pills or opening capsules is that you can never ever crush pills that are long-acting medications. Same thing for the capsules. If it's a long-acting medicine, you can't open the capsule because then you are essentially giving your patient all of the medication at one time. Medications that are long-acting medications are meant to sort of take their effect over a longer period of time, sometimes 12 hours, sometimes 24 hours. And if you crush it or you open it up, then you're giving them all the medicine at one time, right? It gets absorbed, and then they're going to have this adverse effect because the effect is going to be too strong because they got all the medication at once. So it's important that you remember that you cannot crush or open up capsules of long-acting medications. There's another category of medications that you cannot crush, and those would be the enteric-coated tablets. Enteric-coated tablets have a special coating on the outside to protect the GI tract, such as the esophagus and the stomach. They don't actually dissolve until they move into the intestines. And usually we see that on things like antiplatelet medicines, anticoagulants, things where patients would be at risk for a gastrointestinal bleed, or that, the medication could cause heartburn or something like that, some irritation to the esophagus. So we can't crush those pills either, right? Because that should make sense to you. If we crush these pills with an enteric coating, then there goes the enteric coating, right? And your patient's going to have issues with that medication. All right, let's look at just a couple of other things that I have here. I want to talk a little bit about eardrops. So you're going to find that eardrops often come in a dark glass bottle, okay, because generally the medication needs to be protected from light. This is ofloxacin, and the strength is 0.3%. That's right here, all right. And essentially it comes with a dropper. So when you open this up, this is our dropper on the inside, okay? In order to use the dropper, you need to squeeze the top, put it into your liquid, let go, and you will see now that we have some medication in here. When we're going to put eardrops in, we want our patient supine. We want their head turned to the side with the ear that we're putting the drops in up, right, facing us. Remember, for the adult patient, we're going to pull that ear up and back, and for the pediatric patient, we're going to pull that ear down and back. That just sort of helps to open up the ear canal. We never want to warm eardrops. We're never going to put them in the microwave or anything like that, right? We never want to take them out of a refrigerator and then give them to the patient. They should be at room temperature. So when we're getting ready to give those eardrops, okay, we essentially, I'm going to use this little plastic cup as my fake ear, right? So we never want to touch the tip of this to anything. If it gets contaminated, you've got to throw it out and start all over again. And basically, we're going to squeeze this top portion, and we're going to let drops go into the ear. So that's 1, 2, 3, 4, 5, 6 drops, because that's what was ordered. 6 drops of ofloxacin, 0.3% to the right ear. All right, so we put our drops in, and then after you put the drops in, what you want to do is massage what is called the tragus. So this is the tragus, like this little, triangle-y part of your ear. This is the tragus. So you want to put your finger here, and you want to massage the tragus after you give the eardrops. That helps to facilitate those drops getting into the ear canal, which is where they need to be. You want to ask your patient to remain on their side for 2-3 minutes to make sure that that drop again gets to where it needs to go, right? We don't want them sitting up immediately, otherwise we lose the effect of that drop. The other one I want to talk about a little bit are eye drops. So eye drops usually come in very small sort of plastic containers. This is Timolol, 0.25%. So again, what's important here is the top of the dropper. We never want to contaminate this dropper, so we can never touch it to the conjunctiva of the eye. We have to be careful with the cap not to put our fingers in there, and we never want to put this cap face down onto a table. We want to balance the cap on its end so that it remains upright, or you can hold it in your hand, okay, while you're giving the drops. So when you're getting ready to give eye drops, you want to have a tissue for the patient, right? That's very important. You want to, again, your patient should be supine. That would be the best position. You're going to pull down that lower conjunctival sac, and your eye drop is going to go in the inner corner. That's referred to as the inner canthus of the eye, and that's where the drop is going to go. Don't splash the drop on your patient's eyeball, right, because that's just going to make them do this, and then the drop is going to be rolling down their cheek. Don't put it in the middle, because again, when they close their eye, the drop is just sort of going to come out. We get the best absorption at that inner canthus. So we pull down that lower conjunctival sac. We put the eyedropper close to that inner canthus, okay, and we release a drop, right? So releasing a drop would be squeezing the bottle and allowing a drop to come out. Could be one drop, could be two drops, could be more than that, right? Once those drops go in, you ask your patient to close their eye. They have the tissue in their hand in case anything leaks out or maybe they start tearing, and you ask them to keep their eye closed again for 1 to 2 minutes after that drop goes in, and then if they get drops in the other eye, then you move to the other eye. Remember with eye drops that a lot of patients with chronic eye disease, things like macular degeneration or glaucoma, these patients are very used to putting eye drops in their own eyes. So if they have been doing it for the last 20 years, you can give them the eye drops and tell them you can go ahead and give your own drops. However, you need to be there, right? You need to make sure that they're doing it the correct way. You need to make sure that they've performed hand hygiene, that they keep the dropper, sterile. And if there's any question that the dropper got contaminated, then for sure you want to, just discard it and start all over again. I should have mentioned at the beginning of the eye and the ear drops that you should, of course, do hand hygiene yourself, and you should be wearing gloves because you potentially are coming in contact with bodily fluids when putting those drops in. All right, I want to talk a little bit about patches. So one thing that's super important for patches is that you are most definitely wearing gloves whenever you're doing any kind of topical medicine. Now, it doesn't have to be sterile gloves. I'm just putting on sterile gloves because I don't have regular clean gloves. So I'm not going to put them on in a sterile way because you don't need to be sterile. So you want to make sure that you are wearing gloves at all times when you're doing any kind of topical medication. So that includes lotions, creams, ointments, patches, because the same way that these medicines are being absorbed through your patient's skin, they can get absorbed through your skin as well. So I have a couple of different kinds of patches here. Let me see, I have 3 different kinds. So I have a nicotine patch. So this is a nicotine transdermal system. It's a 21 milligram patch, and it's labeled as a stop smoking aid. Okay, and then I have a 5% lidocaine patch that's usually done for pain relief. You might find that these patches are usually bigger because you really have to put the patch on the entire area that hurts. So you use these a lot in musculoskeletal issues. And then lastly, I have something called Nitrodor. It releases 0.4 milligrams an hour of nitroglycerin. You may remember nitroglycerin as our vasodilator from when we talked about patients with angina. So with the patches, you're basically opening up the package and you are taking out the patch. Okay, here we go. Now, what's important about the patch? So, first and foremost, we have sort of a crease in the middle, okay, and the patch has 2 sides, that can be removed, okay? 2 different sides that can be removed. So before you put the patch on the patient, one very important piece of information goes on here, and that would be the date, right? The time, and then your initials. And you want to put that on the patch before you put the patch on the patient. We don't want to write on the patient, right? And then we're going to take off one side of the patch, and we are going to put this patch on our patient's arm, let's say, right? And then I'm going to peel off that second half of the backing, and I'm going to make sure that that's stuck nicely to my patient's skin. Now, the thing about patches is we like to rotate the areas. We like to, I'm going to leave that there for a minute. We like to rotate the areas because, skin can get a little bit irritated from the patch, so we like to rotate the areas. We usually use the upper arms, the upper chest wall, the scapula. We can use the abdomen. We can use the upper thighs, the upper buttocks, lots of places to put patches. What's important in your documentation is that you note where you put the patch, because the nurse that then follows you, or the nurse that has to give the next patch, they have to know where the old one is in order to remove it. So very important to make sure that you remove the old patch before you put on the new patch, because even though this patch says that it's good for 24 hours, it may still have some medication left in it, and then technically if you put another patch on with this one on, you would be overdosing your patient, right? So you want to take off the old patch. Now when you take off the old patch, you peel it off, and what you want to do is fold it in half, right? To make sure that nobody, gets any of this medication. You fold it in half, and then this is going to go in the garbage for non-narcotic patches. Non-narcotic patches or non-controlled substance patches. So let's talk about that for a minute. A lot of patches that we have in the clinical area that are prescribed for patients are for pain relief. And those patches are generally opioids, particularly fentanyl patches, sometimes dilaudid as well. And what's important about this is that when we take these old patches off, we have to discard them in a way where other people would not come into contact with them, right? Because they're controlled substances. So when we take the patch off and we fold it in half, we generally put it in the sharps container, or your facility might have a separate type of bin. Like where I work, we have this green bin that's called the green cactus, and we put patches in there, right? We put any kind of narcotics in there that are for disposal, but the patches go in there. So it's very important that you remember that, okay? So that you get rid of your narcotic or controlled substance patches in a safe manner, okay? The other medications that you're going to practice with in lab are going to include some of the suppositories. Suppositories, if you remember, they are usually made of a waxy substance, so you want to be, really careful when you're handling them, because the heat in your hands can melt those suppositories. They're usually kept refrigerated. When you're giving a rectal suppository, you want to make sure that you get that suppository past the anal sphincter so that it doesn't sort of just melt and kind of slide out. When you're giving suppository, and for our rectal suppositories, we would like our patients in the left lateral Sims position, right, lying on their left side with their right knee kind of up toward their chest. That's the best position. Sometimes we use a little lubricant, which would be water-based lubricant, no petroleum-based lubricants. Now, for our vaginal suppositories or creams or foams or gels, we usually administer these at nighttime, right? Because the vagina really doesn't have the ability to hold anything in. So if your patient inserts a suppository and then gets up out of bed, that suppository is just going to fall right out. So we also, with the foams and gels and creams, they melt very quickly from body heat and they too will start to drip out. So we usually administer those kinds of things at bedtime so that the patient's going to basically hopefully be supine for the night and that medication will do what it needs to do. With those vaginal suppositories or creams or gels or foams, there's always an applicator to use, and when using that applicator, remember that the applicator is for multiple uses. So usually these medicines are ordered for 3 days or for 7 days, and so you want, after the applicator is used, you want to wash it off with soap and water, wrap it up, keep it at the patient's bedside. Now again, I know you don't want to give any suppositories, and believe me, your patient doesn't want you to do it either. So if your patient has given themselves a rectal suppository before or a vaginal medication, you certainly can give them the equipment that they need: gloves, lubricant for the rectal ones, the applicator for the vaginal ones, give them the medication. Make sure that they can tell you exactly how they're going to do it, and you should spend some time watching them do it, right, so that it's done correctly. The last sort of category of med that we'll talk about also in lab and do some show and tell is that of inhalers. And nebulizer treatments. Very important to make sure that your patients are taught the proper way to use an inhaler and how to do a nebulizer treatment. And we'll have gone over the details of that in lecture and certainly in lab as well. So that kind of brings to a close our little discussion on PO meds and meds via alternate routes. Again, remember those 6 rights of medication administration. Please remember that you must do 3 full checks prior to giving any medication. And also take the opportunity to teach your patients about their medicines, right? So that they understand why they're getting it, what does the medication do, what would, what would an adverse effect look like to a medication? Is there anything that they need to monitor while they're taking this medicine? People can't just be given pills and told to swallow them, right? And this goes for any kind of medication, whatever form it may take. Teaching is a very important component of your medication administration. Okay, so that brings us to a close. I want to, of course, thank you for watching, and I'll see you soon.